Thank you, Madam Chairwoman. And first of all, I want to thank you, Ranking Member Scott, Chairman Good, Ranking Member DeSaulnier, and Congresswoman Erin Huchin from Indiana for all your hard work in terms of today's bipartisan markup. It is heartwarming to see our committee lead the way addressing what is one of the most important issues to Americans, the cost of health care. About a half of Americans have employer-sponsored health insurance, and our committee, by virtue of its jurisdiction over the Employment Retirement Income Security Act, has a critical role to play in ensuring that coverage is affordable, transparent, and high quality. The Hidden Fee Disclosure Act, which I introduced this week with Congresswoman Huchin, is a common-sense bill to build on Congress's efforts to make our healthcare system more transparent. As Supreme Court Justice Louis Brandeis famously said, when it comes to public policy, sunlight is the best disinfectant. Transparency by itself can be a powerful force to achieve the goal of lowering the cost of prescription drugs for patients. This financial ecosystem is unbelievably complicated, and Congress has a duty to proceed with as many strategies as possible to address the areas of wasteful spending in healthcare by empowering fiduciaries who administer their health plans for their employees. First of all, let's begin with the basics. Prescription drug prices are now the biggest cost drivers of employer-sponsored health plans. The portion of healthcare premiums attributable to paying for prescription drugs is now 22 cents of every dollar, the largest single share compared to any other category, more than inpatient hospital stays, more than doctor's appointments, more than emergency room visits, and more than outpatient hospital services. Employers and their employees who pay the bill, and I was a small employer for 25 years before coming to Congress, deserve to know that the insurance products that they are buying were negotiated in their best interests. This bill builds on the progress made with the Consolidated Appropriations Act of 2021 and is done in tandem, by the way, with all the other bills because we're amending a separate section of ERISA in this measure. Extends the existing ERISA disclosure requirements to new groups of vendors that do business with group health plans. With this bill, we are clarifying that existing rules apply to contractors like pharmacy benefit managers and spelling out the information about their business practices that they need to disclose to the employers who are their clients that pay for their services. This change will improve transparency in some of the most opaque and costly elements of our healthcare insurance system. There are many examples of practices used to set prescription drug benefits that can lead to higher costs for patients and which justify passage of this measure. For example, a PBM could put a more expensive drug on a formulary because it leads to higher reimbursement for them, even if there is a lower cost generic alternative available, and even if it means that the employer and the patient pay more. Or a PBM could negotiate a rebate for sales of certain drugs, offsetting some costs to the plan, but leaving the patients to pay cost sharing on the full list price of the drug. By sharing information about the types of compensation that PBMs receive, the type of rebates, price concessions, or discounts they negotiate, plan fiduciaries, which are employers and employees, can ensure that they are paying for services that lower costs for themselves and their families, and that dollars aren't diverted to products or companies that don't provide value to the people who are covered in their plans. When combined with other bills that we're marking up today, this will be a powerful tool that will allow plan fiduciaries to ensure that the fees they pay are reasonable and that their vendors are free of any conflicts of interest that drive up costs. This transparency, as Justice Brandeis once said, is a good thing for both employers and for workers. Thank you again to Chair Fox, Ranking Member Scott, and I urge a yes vote on this bill.